Okay, welcome back, everybody. Find a seat if you're still standing. We're starting our next talk, and I'm really happy to introduce Jan Konert from the Gematik. Jan, I think we might call you a healthcare IT native. I checked your CV. You've been already working for a software provider for doctors' offices, for a pharmaceutical company, a medical device company, right? So you probably know the healthcare system in and out, always in IT-related roles. So it just made sense that you made the jump into the regulatory space and brought in your expertise there. And today you're going to tell us a little bit more about what these insured people are doing, how they're behaving, how the rollout for the patients is working in the German healthcare space. So the stage is yours. Thanks for your talk.
Thank you, Philip. Yeah, welcome. My name is Jan, and I'm going to have yet another TI Messenger talk to you today, which I'm really honored to have. Well, before I start, or actually with starting, I wanted to ask you, who here is from Germany? All right, and who of you is publicly insured? Who of you know that you do have your own TI Messenger theoretically available? All right, that's quite good. Who has tried it out yet? And who succeeded? All right, so that's like the stage is set for the expectations of this talk. So that is probably you noticed. It says it's very small but yet prominent. Up to 74 million insured persons could theoretically be using their own TI Messenger today, right now. So, but how did we get there? So this talk is basically about how did we get there, like why did we do it, and how did it work out? So as we heard today already for a couple of times, the first version of the TI Messenger was mainly focused for healthcare professionals to communicate to each other, right? So a doctor to a pharmacist and so on, or between hospitals or just within a hospital. This was already quite great, but the idea was from the very beginning to actually incorporate insured persons into the communication, so that we cannot just steer communication with it, but also to coordinate care, right? So we want the communication network between physicians and patients so that we can use this for all kinds of cases. Marie earlier on showed us a couple of them. So just recalls, appointment requests, or taking patient history. These are just examples, right? Basically, it's all about care coordination. And with this, this was always from the very first beginning on the aim of the TI Messenger. And we started this project quite a while ago. Here, just for the introduction, we see the different versions, the product versions or variants of the TI Messenger, which we already heard of today a little bit. So we have the Pro version, which is already being used today by several organizations in the healthcare sector in Germany. Then we have the TI Messenger IPA, which is new. It was released at the 15th of July in Germany for all publicly insured people. And then in the future, we hopefully sooner than later will have the Connect, which is also there for insured people. But it offers a broader variance of accessing the system. But that's not the topic of today. Probably, hopefully, I will be able to talk about this more next year. So, the TI Messenger EPER, it is hosted within the app of the electronic patient record in Germany. So that is a system since, I think, it's like 1.5 years ago or so. All the insured people in Germany, they have like an electronic patient record where physicians can write data into, they can read it out. This is very useful to avoid basically unnecessary treatment. And within that app of the insurances, you have your TI Messenger app. This is just a mock-up from the Gematik. So you have many different versions of this. And I already said it, up to 74 million people theoretically could have access to a matrix-based messenger over their insurance app. So that sounds like a little bit complicated, doesn't it? Like you have several, like in Germany at the moment, we have 94 statutory insurance companies. And they are all going to develop their own TI Messenger, and they all are interoperable, they are all secure, and they all offer the same set of functionality to everyone. That would be a little bit complicated. But so I'm very thankful that in the end we ended up with having 5 consortia who developed the TI Messenger for the insurance companies. This you can see, these are the logos of insurance companies in Germany or associations of insurance companies in Germany. So under some of these logos like DRK or AOK, there are like many insurance companies behind that logo. And I didn't put them all onto this list, so sorry, but I still wanted the slide to basically be able to show something. Well, so that means all these companies, all the consortia need to follow the Gematik specification in terms of being functionally comparable and being compatible in terms for interoperability, and for also, and this is very important, for being actually secure, so that they only offer solutions that are worth holding your most private information. And then in the end, the outcome that needed to be messengers which can be used to talk with each other, not only among these the messengers of this consortia, but also among the already existing messengers in the field. All right, so that was quite some challenge. And this already brings us to the 3 main challenges we had in this program. Like we had a very fixed timeline and limited resources. A fixed timeline, why? Because the start date for the project, it was defined in the German law and had passed the parliament, and the only instance that could change this release date was the German parliament. So this is quite an obstacle if you want to change the project plan. And the limited resources, we are a more or less public company. You can see we cannot just hire people because for obvious reasons, we are paid off by the insurance money, basically. So the date was fixed, the resources was fixed. And if you look at number 3, security interoperability is not negotiable, then more or less the scope was also fixed. So that was quite some, if you see like the project triangle, that's like some sort of challenging situation. On top, we had a lot of interwoven interdependencies and a very broad set of stakeholders. So that was quite a ride, to be honest. Let's go back a little bit in time. What you can see here is when we really started to work on this project. It was 2023, like more than 3 years, 2 years ago. I was always been bad at math. We started to develop TI Messenger Pro and EPA right after we finished off the release of the specification number 1 and TI Messenger 1.1.1. And later on, we released roughly a year later the release candidate of TIM EPA version 1, which was meant to be used by insured persons. And that was a release candidate. And only a little time later, we were able to actually do the final release. And then only 2 months later, we could also kick off the release candidate of the Pro version, which actually is like the missing part for to work together with the TIM EPA part. And soonish after that, we were able to release candidate the matching TIM EPA version, which also holded a matrix update, which the former version also had. So that is like all the history. And we thought, okay, we are fine, everything will be all right. So now we can kick off the development, and this will basically be sort of an easy ride. But unfortunately, only in late November of the same year we were able to actually release the specifications. And I forgot one question. Who of you has actually worked in the implementation projects of this project? I know there are some here. Okay. So, and you've probably been really happy once the specification finally was released, because I know if you get the order to develop this, you need to have a fixed set of requirements. You don't want to have like a floating sets of requirements, and that was only possible in December 2024. So, November. So that already you can see. That basically means there were 6 months for development for the industry to kick this off. 6 months. And later on, after we released this, we still hadn't done everything for the test environment, for the test system, the test cases. Nothing. It was basically not there yet. And together with our partners, also with the Aquinet, we released the according test systems. So that only with January 2025, we were fully able to accept admission requests for this admission. So we actually don't do certifications. It's like an admissions process. And so that remained theoretically 6 months for the development for the industry. But here you can see it again. You see the companies and the industry partners. It's like a very broad field. And this is just, I'm not going to go into the details of this. This just showcases that the admission process itself also took quite a while. So basically the first version started in April of that year, or even in March later, some of them. That meant even less time for development for the industry to implement this. 2 versions, mainly Team Professional and Team EPR. I don't know how you guys did that, but somehow you succeeded, because actually once we started the admission process together with you, in the end, as we're here today, at the 15th of July, everyone got their approval, got their admission. So the regulatory milestone, which was written in law, 15th of July, you made it. We made it all together. And that was the point actually where the app arrived in the stores. What was the technical foundation for that? The technical foundation, I've learned, was an automated test system, or is an automated test case. So we cannot do this by hand, right? Like not so many different products, so many different variants of the product. It's a system. It's a bit better than it used to be now. I think it takes like 4 hours for a full run nowadays, but it basically automatically tests a system. And it consists out of a reference system, which has been developed by the Aquinet, and it consists out of a test execution environment and the automated test cases, which we deliver as a Gematik. So you made it. And I think the most important part in the whole project was collaboration, because that was really the key. And I might have missed some organization here. If I did, I'm sorry. It isn't by intention. Thank you, everyone involved. This was a very tight ride, but you made it, we made it, and so nowadays we have the app available. But what does that mean? What did we achieve actually? Where are we now? Is everything all right now? Is everyone now using their TI Messenger on a daily basis? Is every pharmacy in Germany, every physician, every hospital is using a TI Messenger just because we succeeded with the admission process? Of course not. These are the numbers of usage right now, and they are increasing, but on a very moderate base rate. So this is the number of active TM Messenger EPA users right now. Or no, not active, but registered. This is the number of users who used their TM Messenger in the last 30 days. And this is the maximum possible number of users at the moment, because this is the number of users who are having a public healthcare ID, which is the ID you need in order to connect to the services. You can also connect to the electronic patient record or to your electronic recipe app. So that is theoretically possible in the moment. What's the path forward? Of course, we want, the value of the TM Messenger isn't defined by the number of people who are using it, right? But then the value actually is defined out of the value it creates in the medical care. Like, how good is it incorporated into a healthcare process? How much money does it save by omitting unnecessary communication paths? But I think we can improve, and we want to improve, and we will improve. So first, accessibility, usability, and integration into care. These are the key factors for the growth, for the future growth. Accessibility means it needs to be easier to get your public ID, like the 3.6 million users that are right now the theoretical maximum. It needs to be easier to connect, to get your ID. And there will be measures. I cannot say at the moment what's going to happen, but there will something happen very soonish. Not only for the TM Messenger. Then we have the usability. Of course, it needs to be usable, right? A physician, for instance, he wants to have the TM Messenger and the system which he uses. He doesn't want, not everyone want to have a messenger on a separate app. The TM Messenger needs to happen in the system which is already there, in the hospital, at the physician desk, in the pharmacy. So how did we get there? And this is something that we will answer soon by a concept, and hopefully in 2026 we will be able to provide the specification which will enable the industry to provide better integrated systems for their customers. And then we have a very important part. There's something in the air here. Oh, Michael, I feel right now. Sorry. Integration into care is from utmost importance. Like, we really need to define the workflows where the TM Messenger saves money in the system, and then really pushing for the usage of these of the TM Messenger for this use cases. All right. So, what is the resume? What is the outcome of all of this? It's basically digital health succeeds when our stakeholders. When our stakeholders, public administration, clinical experts, policymakers, public administration act together under a tight focus and under clear alignment. So that is basically, if you have a project from this scale, work together, collaborate, and then you might succeed. All right, thank you. My name is Jan. I'm the product owner of the TM Messenger and the Gematik. And if you have any questions, please let me know.
Yeah, thank you, Jan, for pointing that out, for giving the great talk, and I hope your voice will survive the questions. We hope we don't torment you too much. And I already have the first question here. Remind everyone before I let the question be there about the channel. So if you're listening online, you can also use the Matrix channel to ask your questions online.
You mentioned that about 3.5 million people have the required public ID. What's with the remaining 70 million?
Well, they don't have an ID, so they cannot use their app from the insurance companies.
How do you get such one ID?
You download the app of your insurance company.
Okay,
and
so
then you follow the process. There's an onboarding process.
Okay.
Yes. It involves paper right now.
Okay, thank you. I think here was another question.
So could you give some examples of how insured people are using the app? So how's it being used at the moment?
All right. For instance, just what did I do the day before yesterday? I had like a question to my insurance company, and I just chatted them. I asked them a question by a chat, and I got an answer. That was that. Or that was like a personal experience of myself. Of course, I used the TI Messenger for that. I could have called them, but I didn't. Yeah. No, it's for physicians, pharmacies, insurance companies. Yeah, everyone like. Well, the broad majority of people, of healthcare professionals using it right now are coming from the hospitals. So I think they're mainly using it for the campus chats. But they can also use it for asking for another opinion to colleagues, to other organizations. What we saw on the model model region in Hamburg was that they had like a very good communication. Like a pharmacist received a recipe and he had some questions about the patient, so he chatted directly to the physician and were able to get the answer. So it really saved paperwork, phone calls, and stuff like that. Yeah.
Yeah, I can also give you some examples later, but that's not my talk. So, but I can tell you a little bit about this. So, I can talk to you later. More questions from the audience. There we go.
Yeah, thanks for your talk. My question is, we heard in the morning that Matrix 2.0 is on the rising horizon. What are your plans to incorporate the new specification also for TIM? So is there a timeline? Is there a plan? You said that the specification process is a long-running process with a lot of incorporations.
Mm-hmm.
And yeah, my question is how you want to come up with Matrix 2.0 on that.
Okay. Let me split it up. So actually our original plan was to do one Matrix update in a year. We are already a little bit over with this right now. 1.15 would be a really good candidate for our next update because it offers, for instance, the OAuth. Well, 2.0, I don't know when it really will come, right? I'm not going to say any date because first I want to see the release. Yeah, but it has some really promising features in it.
Okay, my question, you can probably guess. What about other countries? Are you working with other regulatory bodies in other countries?
Not at the moment.
Would you like to?
We need personal, yes. From an organizational perspective, we need a mandate for that, which has to be written in law. Otherwise, we cannot.
Okay, I guess one more question would be okay. I will look into the audience once more. Give you the chance while I look in the channel if there's anything online. Nothing online, nothing in the audience. Then thank you, Jan.
Thank you.
Big round of applause again.